As announced by the New South Wales Government a short time ago, some of the strongest police action will form part of tough new measures in the state as 466 new cases are recorded in the worst day of the pandemic yet. There'll be increased fines, more restrictions when it comes to leaving homes, extra police and army personnel. Joining me live now for more on this is Dr Danielle McMullen, President of the New South Wales Australian Medical Association. Thank you for your time, Danielle. Now, does the AMA support these new measures?
Certainly. I think we know that our health system is in crisis, as is all of New South Wales at this point. We've been saying for some weeks that this is the worst stage of the pandemic that Sydney and New South Wales has faced. And unfortunately, today is the worst of those days. So we're definitely in favour of the stricter measures, and in fact think everything should be done by government to make sure that the people of New South Wales, no matter whether you're in Sydney, regional New South Wales or elsewhere, have a clear set of rules to follow and know that we all need to be doing our part to be restricting our movement, staying at home and getting these numbers under control.
The Police Commissioner says he won't apologise for these being the strongest laws, the strongest police action. There's pretty big fines. Do you think that these extra restrictions are going to work?
We hope so. We always think that depending on particularly what's happening in regional New South Wales, that more could be done, and New South Wales may in fact need to choose to go into a statewide lockdown with even more significant measures put in place, particularly on regional New South Wales. But at this time, it is vitally important that people from Sydney are not leaving Sydney. These are really strict measures that have been put in place, and I'm glad that our police force and with the support of the ADF are not going to be apologetic about enforcing these rules, because we think they are necessary to keep the numbers under control, get that trend curving down so that we have some time for vaccinations to work, so that our health system can continue to function and deliver care to people who need it most, and so that we can all get back to some semblance of a normal life once our vaccine rates improve.
Now, you mentioned the regions there. What is the big concern with the virus spread into the regions, even in places like Armidale, where no new cases today, but as we've heard, that lockdown's going to be extended for another week?
Yeah, look, even in Sydney, we're seeing the strain on workforce, that every time you have a healthcare worker who's a contact of a case, or if there's been cases in a healthcare service or a hospital, that puts more people furloughed out of work for a few days, at least, if not a couple of weeks while their testing happens. In regional New South Wales, we just don't have that capacity. They don't have the extra healthcare workers to cover shifts, and they don't have the extra space in hospitals and the extra staff and the extra beds to be able to adjust and manage both COVID and non-COVID care. They also haven't had access to vaccines in the same way that metropolitan Sydney has. And so they're really nervous in the regions. We know the communities are nervous. We know healthcare systems in the regions are nervous. And we need to be doing everything we can to keep COVID out of the regions that don't have it already and get it under control in the places that do.
And finally, we did hear the Premier questioned at some length today over why it's taken 7+ weeks to implement these harsher restrictions. Should it have happened sooner?
I think hindsight is always 2020, and we look backwards, and you may wonder why it has taken this long, but I think our focus now needs to be getting it under control. There will be time to pull this all apart later, but what we need to do is recognise that it is not too late. There is still things that New South Wales can do, that all of us can do as individuals, as well as government can do to get this curve trending downwards, increase vaccination rates and get us out of the crisis that we're in.
Thank you for your time, Dr Danielle McMullen from the New South Wales Australian Medical Association.
Thanks for having me.